Hello, everyone. My name is Shannon, and welcome to our debate. In today's debate, we will be discussing concerns related to the use of functional assessment procedures for individuals with severe injurious behaviors in the school setting. Joining us tonight will be Hannah from Christiansburg, Virginia, who is the summarizer for the pro side of both the experimental functional analysis and the functional behavior assessment. Ivana from Toronto, Canada, who is the summarizer for the con side of each assessment. Amy from Charlotte, North Carolina, who is the illustrator for the con side of each assessment. Jenna from Atlanta, Georgia, who is the illustrator for the pro side of each assessment. And myself from Lakeland, Florida. And I will be discussing the cons of using an experimental functional analysis. Within the field of applied behavior analysis, the use of assessment tools and experimental analysis to discover the function of behavior gives behavior analysts the information they need on how to change and control the environment in order to decrease the problem behavior that is being assessed. An experimental functional analysis is a methodology that is a well-established standard for assessment in applied behavior analysis research. It involves the direct manipulation of antecedent or consequent variables paired with the direct measurement of an individual's behavior under controlled trial conditions. Although experimental functional analysis are considered the gold standard in ABA, IDEA 2004 mandates that functional behavior assessments, such as descriptive FBAs, should be conducted to address maladaptive behaviors in schools. The ethical dilemma faced by behavior analysts is whether or not to use an experimental functional analysis with its benefits and limitations, or to use a less invasive descriptive analog functional behavior analysis that requires less time and is less expensive, but maybe as effective in providing information to develop a behavior plan. Hannah is going to start us off by providing us with the ethical codes related to our debate topic.
The codes related to our topic are found in Section 3.01 of the BACB Ethical Compliance Codes. Behavior analysts conduct current assessments prior to making recommendations or developing behavior change programs. The type of assessment used is determined by clients' needs and consent, environmental parameters, and other contextual variables. When behavior analysts are developing a behavior reduction program, they must first conduct a functional assessment. Behavior analysts have an obligation to collect and graphically display data using behavior analytic conventions in a manner that allows for decisions and recommendations for behavior change program development. The other code related to this topic is 3.03, Behavior Analytic Assessment Consent. Prior to conducting an assessment, behavior analysts must explain to the client the procedures to be used, who will participate, and how the resulting information will be used. Behavior analysts must obtain the client's written approval of the assessment procedures before implementing them. Next, Amy is going to share the core ethical principles.
Behavior analysts carry with them a set of core ethical principles. They are as follows. Do not harm. Behavior analysts do not knowingly do harm. Respect autonomy. Behavior analysts promote client independence or self-sufficiency. According to dignity, as behavior analysts, it is our job to ensure that every client is treated with dignity and respect. Benefiting others. The primary role of the behavior analyst is to benefit others in whatever setting or situation they may work. Being just, treating others how you would like to be treated. Being faithful. Behavior analysts are loyal, trustworthy, and honest with clients, colleagues, and administrators. Pursuing excellence. Behavior analysts are aware of the latest research in the field and incorporate the most up-to-date methods and procedures. Accepting responsibility. Behavior analysts take responsibility, accept blame, and make corrections to satisfy the consumer and other related parties when treatments fail. Treating others with care and compassion, respecting the autonomy of clients, working to benefit them and devising programs that accord them dignity.
Amy, what are the 3 specific functional assessment methods?
The 3 specific functional assessment methods are direct observation, indirect observation, and experimental analysis or functional analysis. These terms, functional assessment and functional analysis, are sometimes thought to be the same thing, but they are not. A functional analysis is one specific type of functional assessment. Hannah, could you please explain the difference between an FBA, a functional behavior assessment, and an experimental functional analysis?
Sure. A functional behavior assessment is a multi-step process that includes a review of existing data, parent, teacher, and student interview, and observation of the behavior using ABC data without direct testing. A functional analysis involves direct testing of how certain changes impact the occurrence of problem behaviors. Next, Amy is going to show us a slide on correlation and causation of functional assessment methods.
This visual is the correlation and causation outcomes of functional assessment methods. Basically, descriptive methods can only provide correlational data. This means that all they can do is give a description about how something seems to happen before the challenging behavior occurs, or that something seems to happen after the challenging behavior has occurred. By describing what happens before or after the target behavior, these methods allow practitioners to create a hypothesis about what may be causing the behavior, but they cannot allow a practitioner to say what is causing the behavior. That being said, these descriptive methods can be used prior to implementing a behavior intervention, and as the result, the interventions can be effective. The experimental assessments, on the other hand, allow practitioners to identify a causal link between the antecedent and the consequence of the challenging behavior. So once the causal link has been identified, a practitioner can say that this is causing the behavior. This link can be established because experimental methods will deliberately manipulate or change what happened before or after the behavior to test how these manipulations affect the challenging behavior. Data would be recorded on the challenging behavior throughout each manipulation, and this data will allow practitioners to identify the actual cause of the behavior. And Hannah's going to discuss the pros of a functional analysis.
Okay, a functional analysis uses 4 different test conditions. The first is social disapproval, where the client receives therapist attention contingent on the target behavior. The next is academic demand, where the client is presented several tasks and permitted escape contingent on the targeted behavior. The next is unstructured play, which serves as a control for the experimenter's presence and is conducted in a room filled with toys and possibly stimulating materials. The final method is alone. The therapist is assessing the possibility that the target behavior is self-reinforcing. 3 of the conditions are for testing. The 3 testing conditions are social disapproval, academic demand, and alone. And 1 is used for the control, which is the unstructured play. Frequency data is collected during the different conditions. The frequency data is graphed, and rate of behavior comparisons are made across all condition types. The conditions are presented more than once and in a random order to prevent order bias. Once graphed, if the rate of behavior shows to be significantly higher in one of the 4 conditions, it is assumed that the problem behavior is a function of that condition. Functional analysis can identify causal and maintaining factors related to the problem behavior and has led to the development of effective treatments for severe problem behaviors. Functional analysis is specific and structured and allows clinicians to base treatment methods on an observable behavior. All conditions and contingencies are set in place prior to the start. FAs are found to be more consistently beneficial than assessments based on description of behavior. Interventions developed through FA have frequently achieved positive outcomes by stopping the problematic behavior from producing the reinforcing when a desirable behavior occurs. Next, Ivana is going to explain the cons for experimental functional analysis.
Anna, thank you for sharing some advantages of a function analysis. But there are also some disadvantages in using an experimental function analysis for problem behaviors. So for example, a risk is that the assessment process might temporarily strengthen the undesirable behavior, or the behavior might acquire new functions or function. Also, an experimental function analysis is time consuming. So it requires a considerable training and appropriate staff ratio, as well as it can be counterintuitive to people who do not understand its purpose. And although a function analysis might be considered best practice and can correctly identify the function or functions of the behavior, it is not the quickest and safest way to address at-risk behaviors such as SIBs, and subsequently reduce them. So the behavior analyst has the responsibility to operate in the best interest of the client as per code 2.9, and also has the as well as the client has the right to effective treatment. Sorry, I need to correct myself. Sorry guys, I screwed up.